back a few years ago, the scientists were posing the questions, were designing the experiments, were analyzing the results, the data, and writing the paper with your insights that you share with the whole community. Well, now, not so much. The data can be analyzed for sure with AI. It comes up with its own insights. But now, recently, a few weeks ago, there was a paper by OpenAI and a few physicists that they they did a new theory of physics. They solved a theory. It was theoretical physics, not like a biological experiment. So in that sense, I think AI is going to be, it is already a revolution to every sense of our existence. Um, and with that, I think genomics is one of those areas that will be completely revolutionized by AI.
I agree. It's not changing biology so much as just changing all of the possibilities of what we can do with what we know. Very,
It's
very exciting.
it's changing the way, sorry to interrupt you, the way that we think about biology. And there is, I think, in the near future, we will be getting like new theories and insights from the AI. Today is a copilot. Today is a coworker. It's a tool. I'm not so sure that by the end of 2026 is still will be still the same like partnership.
DNA is the blueprint of life, and now it's the currency of markets. It began with a single genetic sequence, and today, genomics is reshaping industries, driving innovation, and opening new markets. Our conversations explore the people, ideas, and strategies defining the genomics economy, giving you the insights to stay ahead. This is the Helix Exchange, the first podcast about the business of genomics.
Welcome to the Helix Exchange. I'm Meg Samick Smith, and joining me today from Buenos Aires, Argentina, is my friend Dr. Charlie Luzzani. Charlie and I have built in biotech booms and some biotech winters, and we have endured all of the friction and all of the pivots necessary to turn a genomic innovation into a scalable company. And for his part, Charlie has been really early in pluripotent stem cells, 3D bioprinting, RNA enabled genomic screening tools. And in fact, I would say that Charlie operates right at the boundary between science and business. And that's why we would like to talk to him today, because his career is actually mirroring many of the macro shifts in genomics, from experimental science all the way to economic infrastructure. And today we are diving into the topic of genetic repair, which is part of the genomics economy. And it's when biology starts to look a lot less like research and a lot more like infrastructure. So, Charlie, we're delighted to have you. Thank you for joining us.
Thank
And
you for.
yes, we always start the same way. So I want to dive straight into the first question, which is, tell us what's in your DNA, sort of temperamentally, that pulls you towards all these early scientific bets.
What's in my DNA? So I think I'm a mixture. I would say a little bit of an odd duck, if you want. So I'm first of all a father, a family guy. Love my friends, very Argentinian in that sense. But I am also a scientist by training, molecular biologist. I have a PhD in biochemistry and a master's degree in biotechnology. So a mixture of disciplines, but always in the biology track. Um, I, I think I'm also a very forward-looking guy in that sense, and a little bit of an explorer. So ever since I studied biology in the uni, uh, I have been searching for the next big thing. and genomics is one of that. So yeah, a little bit strange in my curriculum, in my resume. I come from academia, but I moved to startups, especially biotechnology startups, which of multiply, that is a genomic screening for cardiovascular diseases, is one of them. Um, yeah.
So you call yourself a bit of an odd duck, and I'm wondering if that's a liability or whether you see that maybe as the guy who's able to recognize the inevitability of something.
Uh, uh, I don't know. I think it's for others to judge. But what I would say is definitely strange to be a little bit ahead of time. So you're always out of place in that sense. You don't have the comfort of riding the wave, but you are waiting for the wave to come. And I think that in a sense it has been very rewarding to, because it allowed me to explore things, do new things, reinvent myself many times over, and meet amazing people like yourself, for example. It also allowed me to change countries, to move abroad, to, I mean, it has opened a lot of doors for me, but it also implies that you have to deal with uncertainty all the time, and to navigate that, which is the startup world, right? Any entrepreneur would say the same, I think. Um, but anyways, I think that in the space and context that we are now, with a major revolution coming in genomics, AI, and other technologies, I think it's also a nice place to be.
Yeah.
Always for the next thing.
So I think I can sum it up by saying you're willing to be the guy who looks a little irrational at the beginning until everything falls in line, starts to compound, and then it's a pattern, and everybody else saw it too, and they forget about the time when you were irrational. So
Yeah, it's you are always the mad guy, the crazy guy, until you're not anymore. But it's fine. I think it's interesting too, and I'm glad I'm that way.
yeah. Well, so we talked a little bit about Multiply, and after everything that we saw at Multiply, why stay in genomics? Why start again?
Oh, um, well, I think genomic genomics went through a little bit of a bubble a couple of years ago. We wrote that with Multiply as well. Um, Very much as the internet and the dot-com bubble, not as big, of course, but the same pattern, I think, in the sense that everyone was in genomics, and genomics was the big new enabling technology. Everyone was investing there. A lot of cash flow went into the space, and then it came down, right? What I think we are now is in a place and in a time when we have to build it up again, just as the internet and the dot-com companies did, in a more sustainable way. I think with the premise of enabling patients, and not only that gimmick of knowing if you're, I don't know, 10% Latino or whatnot. Um, so I think that the technology is there. It has matured. It is being demonetized, so it's cheaper and cheaper every year, more affordable. I think AI also adds a layer of insights that enable everyone to get value out of the technology. So I think that we are in a place where we can build the area again, the space again, and do it in a way that but again, adds value to the patients and to people health.
Yeah, and I think you and I saw also just how much the costs are changing, the cost of sequencing coming down so much, and a lot of shifting even on the regulatory side, and of course that helps to change the story. And, obviously, in up until now, you've really been building on a research hypothesis that you wanted to bring forward. It was cool science. But do you kind of agree with me that we're seeing that it's not just about the cool science anymore? It's that the cool science is underpinning and is becoming kind of an infrastructure layer upon which we can build a multitude of things. Does that resonate?
Yeah, absolutely. Not only that, I think that, as I said before, with the improvements that science is bringing to the genomic space, you enable new business models, right? So back when you have to run a whole genome on $500 was one thing. Now that you are sure under the 200 barrier, and there was a piece of news lately that one startup is running whole genome sequencing under $100. It enables you, it opens other doors to be creative with your business models, to open, yeah, like profitable businesses where you couldn't before, to reach more people. And I think people who has been sequenced is so low. The amount of people, I don't remember the actual figures, but it's like 0.5, 0.1% of the whole population, like, or even less. What happens when everyone is sequenced, or
Yeah.
50%
Yep.
of the population is
To-
sequenced?
Totally new.
So I think that science is an enabler, sorry, in that sense. It's not that you will leave science or the scientific breakthroughs apart, but I think that they promote new ways of making money in that sense, and to reach more people, right? I think that's the creative part. That's why I'm saying I think that we are in a moment where we can build back up the whole space and do very interesting things with it.
Well, it's a perfect pivot to Vesically, your current venture. Tell us
Okay.
about that and tell us what are exosomes and vesicles, and just tell us as if we are a group of people who want to allocate some capital to your company. Give us the pitch.
Okay, yeah. So the elevator pitch is that basically helps design and build uh, exosome-based therapeutics and therapies to restore the body's own regenerative potential. So what we are doing, and I will explain what exosomes are in a bit, but what we are doing is basically, and a wound dressing for chronic wounds, especially for old people. This would be diabetic foot or pressure ulcers from being in the hospital for quite some time. And the way we are doing this and how we leverage exosomes, that exosomes are tiny vesicles. Extracellular vesicles is the scientific term, but it's like bags that all of the cells shed to the environment, to the extracellular niche, if you will. That's the terminology in biological terms, and they are packets of information. I think that's where it also touches with genomics. So they are like little bubbles that any cell sheds and goes into other cells to take a message with them. I always describe them as the perfect Trojan horse in biology, because they are assembled in a way that it's very easy for another cell to take in, and that allows you to command a message, right? In our case, our exosomes transmit a message that is pro-regenerative and anti-inflammatory. What it helps is it promotes that the skin regenerates itself, so it starts growing again. And if you have a chronic wound, a wound that won't heal, this allow you to heal it not only much faster, but with a much better quality. it doesn't leave scar. It promotes the hair to grow back again. So in a sense, we are leveraging information, but instead of taking information, we are giving information back to the body for it to heal.
Okay, so that's kind of the science, and then how do you put that into the product? How do you take that innovation and move it forward?
So it's a wound dressing, like a band-aid. Think of a band-aid that goes directly into the wound. And this is for hospitals or specialized clinics like burn clinics, chronic wound healing clinics, and eventually into defense also. Is like, I think it's the band-aid of the 2030s, if you will. We are still in preclinical studies. We have tried this in vitro and in vivo in mice, and we are moving into much bigger in vivo models like pigs now. So anyone that wants to know more about, basically, please just tap.
Yes, so it's so okay. So you're building the band-aid of the future,
Mhm.
and you're moving from just kind of covering over the wound or the burn or abrasion, and so that would be like masking the symptoms in a way to really initiating the repair. Did I get that right?
Yeah, so imagine that you have a wound that won't heal, right? As I said before, a diabetic foot, or maybe a pressure ulcer. Many people in the audience will relate to this. Sometimes it's a life-threatening wound, but most often it's a wound that really affects your quality of life. It's like, if it is on your back, you can't lay down properly. You're always uncomfortable. The only treatment that you have for that right now is what is called a vacuum treatment, that is going with a device, literally the whole life, and or painful treatments.
Okay.
So this is nothing like the sorts. This is a band-aid. This is a wound dressing. You put it onto the wound, and it will promote that the skin grow back again. So usually what happens with chronic wounds is that you have some sort of pathological process like diabetes or something like that, that avoids, like, blocks the own regenerative processes from
Right.
the body, from your body. So this gives you the advantage again, and enables your body to heal naturally. That's the, I think, the power of the exosomes in this case.
Yeah, really interesting. And you mentioned the first aid kit of 2036. And thinking about that and thinking about wound care, what's the first adjacent market that you think will come up after, diabetic wound care and hospital-based care? Where else can this go?
Eventually, I think that, so imagine Star Trek. If you have ever seen that sort of things where everything is magical, it's like you apply a spray and you are magically healed. Uh, I think that we are going into that direction, or at least we need to make it go into towards that direction. Today, if you have a really nasty wound, what do? Either you go to the hospital and they stitch it up, or yeah, you don't have many other options, right? And everything is mechanical. You have to stitch it up, or I don't know, the vacuum appliances to stimulate growth, or whatnot. I think that we need to move into a biotechnological
Yeah,
kit. First,
regenerative medicine kit.
exactly, where you apply like a magic spray. I don't want to, like, to sound like magical thinking, but what if we could do that? What if we had the technology to do that? And I think the exosomes goes towards that direction, in the sense that this is a hydrogel patch that you apply into the wound. It is absorbed by your body, and that by itself regenerates the wound. And as I said before, imagine now we can see it in a hospital setting. what if we can take that into the battlefield? What if we can take that into our first aid kit that we have in the car or whatnot? What if this is part of your everyday life? You
Yeah.
have a nasty wound and you just put a patch on it and it will be better tomorrow. It's yeah,
Yeah.
that's
That's that's an exciting future. Well, sticking with vesically for a minute, what do you think would 10x vesically tomorrow? Is there a partnership? I mean, who are you calling when you want to expand this?
yeah. So I think that first of all, we have to be real about this. There is no exosome-based therapy approved yet by the FDA or the EMA. So what I would really push for is first to have a clear path towards approval, regulatory approval with this. It's the same in Latam. It's the same in I think anywhere in the world because it's so at the frontier of what we can do. Um, but then I think there are companies like J&J and others that are working on Takeda, are working on regenerative medicine. Um, and I think that this has to be a part, exosome technology has to be a part of all the major companies. Usually they are very cautious of venturing into areas where it's not yet proven because there is no product in the market. But that's where the startups are pushing the envelope, you know. But what I would do is, yeah, call anyone that hears me that's developing anything with exosomes. Let's syndicate. Let's partner up. We have an amazing production pipeline, an isolation pipeline. So happy to talk to anyone that wants to mass produce
Yeah.
these guys.
So it sounds, if I can put that all together, like you're looking for a partner with some regulatory fluency. Uh,
That's one,
yeah.
yeah. And I think big pharmas that are in the space. So any partnership with big pharma would like
Okay.
jumpstart our,
So
our journey.
yeah, so big pharma or anybody with regulatory fluency and manufacturing and distribution take a bet on bringing this innovation into what they're already doing. Very cool.
Absolutely,
Very
absolutely.
interesting. So, not just a better bandage, a totally better signaling platform, signaling to the cells around to get going and repair. Got it right?
Yeah, yeah,
So,
absolutely.
so turning to the investors, most of our audience are in finance and business, and so what do you think these smart investors and business leaders still are misunderstanding about biology in general right now?
Well, I wouldn't want to put myself into their shoes. I think that they are savvy enough and they know a lot. I can tell you what I have seen of the space, and it's just my journey from the other side. I think we so I went through a time when it was post COVID and there was like almost free money in the market and everyone was investing in biotech because it was the cool thing to do after COVID. And many came from software. Um, and many investors were burned by the time frames that we usually have in biotech, right? So I think that one thing that I've seen the investment community do is try to expect software revenues and multipliers and time frames that are not for biotech. Um, biotech is more similar in that sense, I think, to hardware in the sense that you have to invest quite a lot of time and money to start seeing results because you have regulatory approvals to go through. And if you don't start building your company to be approved, you won't make it even if you have wonderful science. So it's more than science that you need in biotech. You need the infrastructure, you need the manufacturing capabilities, you need the regulatory compliance, you need the business model. But it is, in the end, a business model that you cannot test without being approved. So that hinders a lot of investors to come into biotech. Um, what I would say is do it all the same. I know it's not the same maybe ROI that an AI company might have, where you can test the market and your product, or if you have um, an MVP in months. Uh, but for sure, it will create a new future and a brighter future for all of us. So
Yeah, I
yeah.
think that's a good advice. And now I'm really thinking about the sort of durable value in biotech. And I think you're close enough to give advice. Is it therapies or is it infrastructure? What's a better durable value investment?
So uh, maybe I can go back a little bit. There are all these platform companies, right? So I'm not talking about basically anymore, but more broader to the therapeutic startup world, where you have a technology that enables you to create assets, no matter what asset, but different assets. So if you are betting into one therapy, you are placing all your eggs in one basket, right? If that doesn't go, that is not approved by the FDA, but by the EMA, then the company tanks. What you always can do is bet on a technology. And I think that, again, the technology is the big enabler there. And if you bet on, I don't know, to take it back to genomics, yeah, maybe you're not betting on one company, but you're betting on the vertical, on that technology, or new technology that enables you to do something else.
Yeah.
So that, I think that is how I would frame it. Go go for technologies, or at least startups, companies that have a different vision of the future, and and how they can implement it, what they have between hands that can change something. Not, and usually the asset is like the how do we say, the example of the underlying technology, but not that same company might have a bigger portfolio in 2 years time or 3 years time. So um,
So I'm hearing something with broad applicability that has a platform or infrastructure kind of feeling where it can be the base of many, many things.
yeah, to give you an example with exosomes, like basically I think exosomes, and I am biased of course, but I think exosomes are what monoclonal antibodies were 20 years ago, like a huge, promising platform technology that will change the way that we do cell therapy. It's like doing cell therapy without putting the cells. So it has all of their advantages without the safety concerns of putting cells. Of course, they have challenges, but we will solve them eventually. But what I mean with this is that even though there is no therapy or therapeutic based on exosomes already approved, we are almost there. And once the first one goes through, it will be a revolution, because we can do so many new things, so many different things. It enabled us to do so much that once the first one is approved and one company proves that this is something to be that is worthy, I think that there will be a stampede.
I think so too. And I think that's what keeps both of us excited about the topic of genomics. So much promise. I want to shift to AI and how it's changing biology. Is it just speeding it up or is it doing something else? Obviously, you've been following all of the different technologies in the space. I just want to get your take on whether it's really enabling scientists or is it just simply a time, reducing the time?
Well, I won't be the first to say that it's a revolution. Um, in every sense. I think that it's a revolution in science, in society, in the workforce, in stocks. I think it came to absolutely, I think, change the way we interact as a society, as a species. Um, in particular, in science, to focus and narrow it down to it, I think what it has become is um, the insight layer, right? So back a few years ago, the scientists were posing the questions, were designing the experiments, were analyzing the results, the data, and writing the paper with your insights that you share with the whole community. Well, now not so much. The data can be analyzed for sure with AI. It comes up with its own insights. But now, recently, a few weeks ago, there was a paper by OpenAI and a few physicists that they they did a new theory of physics. They solved a theory. It was theoretical physics, not like a biological experiment. So in that sense, I think AI is going to be, it is already a revolution to every sense of our existence. Um, and with that, I think genomics is one of those areas that will be completely revolutionized by AI.
I agree. It's not changing biology so much as just changing all of the possibilities of what we can do with what we know. Very,
It's
very exciting.
it's changing the way. Sorry to interrupt you. The way that we think about biology, and there is, I think, in the near future, we will be getting like new theories and insights from the AI. Today is a copilot. Today is a coworker. It's a tool. I'm not so sure that by the end of 2026 is still will be still the same like partnership.
It's a great soundbite. I appreciate that. Um, so,
So
looking backwards. So, let's say we're now in 2036, since we were talking about it earlier. Looking back to this point, 2026. Um, what do you think that we totally underestimated when we are looking back? What will we say? Like, oh, it was so obvious
about AI, you mean?
about AI, about genomics in particular. What will we have missed, or what will we go back and say, oh, um, yeah, we totally underestimated what that would be. It,
So in 2036, looking backwards to today, that's what you mean. What what I can tell you is that I think humans are very bad at thinking exponentially. So we tend to think linearly and uh, incrementally, if you will. So it is hard to, with all of these technologies, to really figure out the future, because once you are in the famous singularity, you cannot see the future by definition. So I think that we are there. If we are not already in the singularity, we are almost there, like 1 2 years 3 years, who knows. But uh, so when I try to think the future, I think I'm missing the ball completely, because um, even though I can, in my wildest dreams, whatever I can think about 2036, I'm sure I will be uh, far away from the target. So what I'm trying to say here is that even if I tell you AI will take hold of all the genomics analysis by the end of the year, I might be already wrong. And the same with any technology that comes or can improve with the AI. So I will leave you with this question for your audience, maybe to think about, is that what happens when AI not only interprets the data that we are generating today, and give us insights about that. That is one thing that we can all imagine. We are living that future already. What happens when AI designs new hardware, new technology, new ways of getting the data, so that it start like a feedback loop that it goes out of hands very very quickly. So what if the next genome sequencing technology is designed by AI for AI? We are out of the loop completely, and I think that can be a reality very very soon. So in that sense, you can't imagine a future where humans are not part of the loop, and yet.
Yeah. Well, I wasn't even thinking about all of that. I was almost thinking more about mainstream adoption of genomics. Um,
Ay,
but
sorry.
all no, all exciting and very thoughtful. But I'd love to know also what you think. Will these genomic therapies like vesically, like multiply, will they have their day? Will we look back and say, like, how silly that they took so long, that there was so much regulatory scrutiny? What will it look like, do you think?
Well, I think that we are due a regulatory update, in the sense that um, I think the pace of technology, of the new therapies coming into reality, and the adoption that they could have, um, is not going hand in hand with regulations and their timing. Um, of course, they are necessary. They are there for a reason. So it is okay that we are operating in a regulated environment. Sorry, that's perfectly fine. But I think that it needs to be leaner. It needs to be more agile. Um, and the pace of the technology will only increase. So yeah, absolutely, I agree with you. We took all these years to get to market, and now the future will be completely different. But that is how the exponentials work, right?
Yeah.
It's first a trickle, then a flood. So it's incremental changes that in at one point in time it goes up.
So is it fair to say then that genomics is not just an emerging thing, that it's actually infrastructure?
Yeah, so I think that the infrastructure is there, will get only better with time. And as I said before, I think genomics is it's not a revolution anymore. I think it's a big enabler for the whole med tech community. Um, and it will get more and more. It's a foundational layer. What I would say is that is the foundations of the medicine of the present and the future, I think.
So this, I can now say that the shift has already happened. We just maybe didn't notice that it had happened. Is that about right?
About right. And as I said before, I think that uh, the bubble burst, and now we are building back in a more sustainable way, on the shoulders of everything that has been done so far, and with AI as the future. Uh, so I think the interconnection of those two technologies, genomics and AI, will for sure get to the every person in the world in the future.
Well, I think that is a perfect place to end. Charlie, thank you so much for helping us map this little part of genetic repair that is a part, of course, of a larger genomics economy, and helping us walk through what you've been up to and how you view the world. For those of you in the audience, if you liked this conversation, of course, please like us, follow us, and subscribe to Genomics Media on YouTube. And if you want a deeper dive and long form content, go over to Substack and visit us at Genomics Media there. Until the next time we meet each other, thank you.